In the early 19th century, there was a doctor named Ignaz Semmelweis who worked in a hospital in Vienna, Austria. At that time, hospitals were often unsanitary and had high mortality rates due to infections. Semmelweis noticed that women who gave birth in the hospital where he worked were much more likely to die from infections than those who gave birth at home. Semmelweis believed that the cause of these infections was doctors who were performing autopsies and then delivering babies without washing their hands in between. He proposed that doctors should wash their hands with a solution of chlorinated lime before examining patients, especially after handling dead bodies. However, Semmelweis's idea was met with resistance from other doctors in the hospital. They believed that the idea of invisible particles causing infections was nonsense and that Semmelweis was overreacting. Despite the pushback, Semmelweis implemented his hand-washing policy and saw a significant decrease in the number of deaths from infections. But, his colleagues continued to ignore his findings and ridiculed him for his obsession with cleanliness. Semmelweis became increasingly frustrated with his colleagues and the lack of recognition for his work. He eventually left the hospital and moved to Budapest, where he continued his work and advocated for hygiene practices in hospitals. Unfortunately, Semmelweis's ideas were not widely accepted during his lifetime, and he died in 1865 at the age of 47, largely forgotten and unappreciated. However, his work laid the foundation for modern antiseptic practices, and today, hand-washing is considered a fundamental component of infection control in hospitals and other healthcare settings. In conclusion, Ignaz Semmelweis was a pioneering physician who faced resistance from his peers for his ideas on hand-washing and hygiene practices. However, his legacy lives on, and his work has saved countless lives by reducing the spread of infections in healthcare settings.